Yesterday, I was clever, so I wanted to change the world. Today, I'm wise, so I'm changing myself.
What about tomorrow?
Technology is here before we expect it, and the best way for us to take the next step and create the future of health and medicine is to go and create it ourselves.
How? Let's journey into tomorrow and beyond.
Welcome back to Health Beyond Tomorrow. So I'm joined with Dr. Ali Jaffee today. Ali is completely redefining the way we approach healthcare, placing a specific emphasis on nutrition, mental health and well-being. She's honestly a huge inspiration, not only to myself, but thousands of people in the field. And this is not only just because of her dedication in improving patient care, but actually because of her relentless pursuit to normalizing mental health conversations amongst the clinician and healthcare community. This episode is extremely raw, but I believe it's essential that it needs to be amplified. Conversations like these need to start being had, and the mental health of healthcare professionals is often underplayed and undervalued. So we are striving to change that. We want to change this narrative. We delve into a range of topics in this discussion, ranging from Ali's entrepreneurial journey to some of her struggles, how she overcame them, and the future of nutritional psychiatry and digital mental health. So if I was to ask you, what is your biggest achievement? Me personally, mine is setting up this podcast. I'm proud of the episodes I did with the BNRB MedTech podcast, and now I'm proud of the Health Beyond Tomorrow podcast I have now launched and looking to scale. So for a second, I want you to think, what is your biggest achievement? I start off this episode by asking Ali, what is hers?
My biggest achievement in life in general, when anyone asks me this question, which is quite often, is my mental health is my greatest achievement, and actually getting to a place of recovery from when things were so dark and there wasn't even a glimmer of light or positivity. So I always say my greatest achievement is getting to the other side, because that feels like always the most uphill battle when you're really going through it. Being able to educate and be an advocate around this, I think is something I'm really proud about, being able to share my story and learn from other people's stories as well. I really enjoy interviewing people and hearing their lived experience.
No, rightfully, you should be proud of it, because it is a huge achievement, and it's even a bigger achievement as well that you're able to then be vocal about it and share your story and tell, because that is not easy at all. And share your tell in a way which does then inspire students or anyone who was in a similar position to you to then get through it. So tell me a little bit about those struggles that you conquered and got through, and where did they first begin?
Sure. I guess it started, so I began medical school with a mindset of this imposter syndrome. One of our head of years said, "You're all very clever, you all have the right to be here, you were all top of your class at school, and you're all the best of the best in the country, we've handpicked you." We had some sort of toxic lecture along those lines, and I remember thinking to myself, oh, I'm really not top of the top academically, I'm just a very passionate and hardworking person. So I knew from the onset, Ali, don't mess medical school up, work hard. So that was always a narrative running through my head. So I put so much pressure on myself, and I also really had this need and almost calling to leave a legacy of some sort. And I don't really know where that comes from, but that's when very early on, when I started medical school, I knew I wanted to try and innovate the system and make a change to policy and educational guidelines. And my greatest passion is around preventative healthcare, and that was something that really came to me on my gap year when I was traveling and exploring different communities. And I did go and see certain health practices when I was out in Australia and in the US, and saw a lot around lifestyle medicine and holistic healthcare. So I really had a lot of priming around what I was interested in before starting medical school. So I started quite focused, that I knew the type of medicine I wanted to practice and what my values were. And so when I was sat in my lectures, I realised, oh goodness, I'm only learning about the pharmacological interventions, the surgical interventions for conditions. Where's all the incredible stuff around what patients can do themselves to prevent and manage their chronic conditions that I'd read about in research papers, podcasts, books? etc., etc. And I slowly began to find this gap that I really wanted to try and fill when it came to educating the healthcare workforce around nutrition and lifestyle medicine. And I really found this problem and saw a huge market to try and create a solution. And that's when I formed NutriTank. I met a fellow medical student, Dr. Ian Broadley now, who was on the exact same page of me, and we co-founded it together to really make this difference within healthcare training, so more doctors and medical students alike can talk to their patients about diet and lifestyle in an evidence-based and meaningful way to help them make changes to their life. But all the while, I really just neglected my own mind and my own mental health. I was so interested in the academia and innovation around the field, I didn't even consider myself to be affected by such things. And it's the whole, oh, this will never happen to me, I can just keep going, I can willpower myself out of things, and all these kind of toxic mindsets. And then it got to the stage where my first 3 years at medical school, I was definitely suffering from generalized anxiety disorder that would come and go, and that was that. And something would happen that would bring my mood up, and then the anxiety would go. And I was at the mercy of life and things in my external environment. So essentially not very resilient, just wavering to whatever was coming my way. And I completely neglected my mental health. I started experiencing panic attacks, but always managed to, summer would come and I'd recalibrate and all would be gone. I never really dealt with it. And then I took this intercalated year at Imperial. And then halfway through that year, I had a very big family tragedy that essentially triggered a clinical depression that I believe, looking back on it now, was always coming my way. And as much as the person who passed away meant a lot to me, it wasn't actually their death that propelled me into it. It was just the final straw. So I fell into this clinical depression. It was a very challenging time for me. I didn't really know what was going on. It was the strangest thing not to really have that intuition and be able to recognize it in yourself. I didn't wash my hair, I didn't make myself food, blah, blah, blah. And got to the stage where I just didn't want to see my GP. I really had this stigma about going to see my GP, about my mind. I tried talking therapy. I was like, clearly there is something wrong psychologically, go see a psychologist. But I didn't have any capacity to engage in a conversation because of the brain fog. I also wasn't sleeping, I wasn't really eating. So I had no battery in me to have a conversation around behaviour change and digging into the trenches of my mind. And then eventually it got so bad that I was forced by my loved ones to go see the doctor, and she was amazing and really understood where I was at. She said, it's absolutely fine. This happens to everyone. It happens to boxers, Olympians, athletes, actors. Just don't think that you can't do what you want to do in life because of this. This is a challenge in your life. This isn't who you are. Yeah. She was like pretty amazing.
I'm going to pause you there, and thank you for sharing that story. I know obviously it's not easy. Yeah, it's not easy talking through. Well. Exactly. It's not easy talking through your whole story, and especially when the story's been difficult and you're reliving some experiences that aren't easy. And so I want to stop you there, because I think the hardest part is obviously having that courage and strength to identify that, you know what, it's not okay, and to actively seek that help. And I think especially amongst students and amongst medical students who are high achieving, we do have that toxic outlook where we're just like, this can't happen to us. We're the doctors, we're the med students, we're the ones treating patients. We can't get mentally sick. And so what would you say of words of encouragement or some advice in hindsight? How would you have gone about that whole period a bit differently to identify a bit earlier that something wasn't right and actually go and seek help a bit earlier?
Honestly, this is my biggest tip when I say this is my biggest tip, is seek help the minute you think something is wrong. And you're not wasting anyone's time, and you're gaining your own time back, because you lose time when you don't make a first move, essentially. And I think you have to accept the help, because you can go in with all the best intentions because your family have forced you or someone, and you can just not listen or not take it on, and you really have to accept that help. And for me, I'm very grateful that antidepressants did really work on me. It's not a guarantee. We're all different. There's no one size fits all. Genetically and physiologically, it might not all work on everyone, but it did for me, and I really did see a difference almost within 3 weeks. I was able to start sleeping and physiologically recalibrate to be able to think straight of how I'm going to move myself forward. And then I was able to actually engage in the talking therapy in a much more effective manner.
And so tell me a little bit about now the next stage and the difference in just in general productivity, your overall life, and how coming to that realization that something isn't right, seeking the help, and then starting the medication and talking therapies. Tell me about now the difference in everything.
So I use the analogy of drowning out at sea and getting back to shore. So when I was in the depths and the real trenches of depression, I was drowning. And what was my lifeline? What was the life jacket that literally got my head above the water? It was the antidepressants, because without getting my head above the water, I couldn't make a plan to swim back to shore. So I'm a big believer in holistic mental health, and not saying that one thing is the panacea, and also not stigmatizing anything. So the antidepressants got my head above the water, and then to actually swim back to shore so I could live my life and thrive, I essentially went to talking therapy and was able to engage in something called innate health and resilience training. And then in terms of real self-care, and what I mean by real self-care is this new phrase that I've learned from a book I'm reading by a wonderful psychiatrist. And the whole thing around real self-care is actually doing things that aren't from the wellness and marketing industry to try and capture your attention and make you spend money on, but actually doing things that will nourish your mind and body. Essentially eating well, eating for my brain and eating for my body, that was something hugely beneficial for me, and a lot of the stuff that we did with NutriTank really helped me and the experts I had access to, and moving my body through yoga and putting up boundaries and learning how to put up boundaries with people in my life and also myself.
Definitely. That brings us on nicely to the next segment, which is nutritional psychiatry. So tell me, what is nutritional psychiatry, and how learning about how the nutrition affects your mind can actually be beneficial for everyone?
So I am a huge advocate for this. I think it is one of the most exciting advances that we're seeing in psychiatry and psychology. And it's a field that's really in its infancy. It's only really been around for 10 years from a research basis. And one of the key research studies that came out that really affirmed the field as something serious, there was an RCT called the SMILES trial by a team over in Australia at the Food and Mood Centre, led by Professor Felice Jacker. And the SMILES trial was a randomised controlled trial that looked at an Australian female population with clinical depression. And they randomised the patients into 2 groups, one with traditional depression therapies, so an antidepressant and talking therapy. And then the other arm of the study, the second group, was to have a modified Mediterranean diet and dietary counselling with a dietitian and coaching throughout the study period. And what they found was that side of the study, that arm, did better, essentially, in terms of the effectiveness of reducing the depressive symptoms. And it was a really powerful study to show that actually food can be medicine and it can be therapeutic. But you have to then wonder, and this is the bit where I believe in holistic mental health. Obviously, it was for, I can't remember the number, but it worked on a percentage of people in that group. It didn't work on everyone. And that shows you that personalised medicine is so important. There is no one size fits all, but nutrition is one huge component of recovery, and something I really think we need to be investing far more in a much healthier food environment for our patients, because we know that ultra-processed foods, which are hugely topical at the moment in the news and lots of health documentaries, they really do drive a lot of chronic conditions and lifestyle-related conditions. And so I do believe that the field of nutritional psychiatry is so exciting, and unfortunately, mental illness and mental health services and nutrition are almost two Cinderellas within healthcare. Most of the time, they both are underfunded or under-researched, and I really hope with work I do in the future that this field can really be brought to light, as I think there's so much that can be done.
Definitely, yeah. It's interesting because with mental health in general, no one really knows how it works. No one really understands how antidepressants work, how SSRIs work. No one understands the mechanisms of what causes people to feel low, etc. And I did my dissertation on OCD because I was just fascinated by like the symptoms of obsessive compulsive disorder. And when I did it, you just realize how many different hypotheses there are, and no one understands fully what causes it. And I guess what I'm alluding to is, if we don't understand ourselves as clinicians, what's causing it, how can we understand going forward how to prevent it or how to treat it properly? Does that make sense?
I think that's an amazing question. It's an age-old question, and that for me seems like a challenge on paper, but it's actually why I love psychiatry, because it's art and science, uncertainty, grey areas, and leaves you as the clinician to have your own approach, because that it can be personalised, and that's what you'll see. It can be very frustrating as a trainee. There's a group of critical psychiatrists, and they often will write about how all we do is give out medications for symptom control, but don't ever get to the root problem because we don't understand what the root problem is and what's driving it. There's so many schools of thought when it comes to this question, and there's lots of different hypotheses. It comes down to the fact that with mental illness, we don't have a lot of tangible, quantitative evidence to go off.
So you've used the word holistic and personalised as a form of medicine to get the best patient outcome throughout this podcast. And so I'm curious, how are you guys at NutriTank aiding clinicians and empowering clinicians to be able to provide patients with the tools to make sure that the treatment they're getting is personalised to them? Because at the moment we obviously just follow the guidelines, and step one is always focus on lifestyle prevention, diet and stuff, but as we all know, as all doctors know, that's always skipped, and because it's just easiest, the first thing to do is just get your pen and just prescribe. And so how are you guys making sure that first step isn't actually missed out, and a patient is, as a doctor actually, we're educating patients properly around the benefits of looking after your nutrition and the benefits of that in preventing chronic diseases, helping mental health issues, etc.?
So we've been going at it for around 7 years now, which is crazy. And the simplest way to describe the work and how we've made an impact is through the top-down and bottom-up approach we took. So from a bottom-up approach, very early on, we wanted to get as many medical students involved and make it into a movement around greater nutrition and lifestyle education within healthcare. So as millennials do, we took to social media and we managed to find lots of like-minded students who wanted to create their own NutriTank branch, and that's what we did to start off with. And then today, in 2023, we've now got most of medical schools with a NutriTank branch to really be a place where students can learn about nutrition and lifestyle, not only for their future patients, but also for themselves, because we know that medical students are at higher risk of mental illness than as are doctors and other healthcare staff. Self-care is really important. So from making that community and real connection network, we then knew the importance of basically contacting stakeholders and getting top-down approach. Luckily, through the media and through just shouting out about our mission, we were invited to join an interprofessional working group that the GMC put together and put the Association for Nutrition in charge of. And that was to create a gold standard undergraduate nutrition in medicine curricula for medical students. And that work started in 2019. And there were different members of royal colleges and dietitians and registered nutritionists, and myself and Ian as the medical students and the kind of future voice. And we essentially devised this curriculum, and it launched in 2021, and that is now the gold standard nutrition curriculum. And then the next phase is obviously implementation. So we've been using our branches as influencers and kind of people on the ground to talk to their faculty about their want to have more nutrition in the curriculum, that this curriculum now exists. And so essentially it's there, it's now in the curriculum, it just comes down to implementation. So we are working in a coalition with other nutrition education educators, and we are trying to find ways to incentivize medical schools to get more members of staff to lead on the nutrition and make sure that it is a huge emphasis within the curricula. So we've done very well with the first kind of phases. It's just certain medical schools are doing better than others, and we're hoping to make a league table of medical schools who are doing good jobs and incentivize the faculty to really prioritize it, because this is the situation we're in. It's a public health concern. We really need to teach tomorrow's doctors how to talk to their patients about diet and lifestyle. We also are an online community and a clinical medical education provider. So we host a number of webinars that are CPD, CME accredited for healthcare professionals and students, all around nutrition and lifestyle. We've got a current series on at the moment every Tuesday night, mainly aimed at junior doctors, but anyone can join, with a whole array of expert-led, brilliant lectures. So I urge you to join them.
You spent a lot of that talking about how you're getting your voice heard in terms of these different branches, and you've done a great job getting your voice heard initially to begin with. But tell me a little bit about now this digital solution, medical education part you're working on, and implementing that and making this. Is your vision to make this a global platform where all clinicians around the world could listen to?
Yeah.
Because I guess this ties in with my next question, is the fact that nutrition is very different for different ethnicities, specifically amongst, for example, South Asian populations. They're naturally just more insulin resistant, hence they should be tailoring their diet and lifestyle around that, but that isn't talked about enough. And so just tell me a bit about that.
Yeah, so I couldn't agree more. And one of our huge core values and educational elements is that the nutrition education we provide is culturally inclusive. And so we've done a lot of work with brilliant dietitians such as Fariha J, and she's got quite a good nutrition Instagram, and she's a very qualified senior dietitian. And we've worked with her to create South Asian and Afro-Caribbean nutrition education resources. And a lot actually is starting to be populated in the landscape as well, because it's such a big issue, and we just really can't sit and talk to a patient about the Mediterranean diet just because it has the largest evidence basis, when it means nothing to the Somali gentleman sat in front of me who isn't going to use olive oil and some of the other ingredients that we mentioned to him. You have to meet the patient where they're at and make it culturally inclusive and relevant to their lifestyle. So I'm really pleased that we're involved in this work and that this work is being done, because otherwise it's just going to be futile if we're just targeting a certain demographic of the population.
Yeah, it's really great. And so I'm going to ask you now, what is next? What is next in terms of improving mental health as well? Because I was at Pure Gym the other day and I saw a great campaign just about JAAQ, which is a mental health app.
I'm working with them.
Oh, are you? That's great. Yeah. And then obviously Apple iOS 17 has recently updated, and they are rolling out a mental health tracker. And so it's slowly becoming more normalized. So how can we continue that trajectory in terms of public campaigns like these? And
so hype JAAQ a bit, because I want to give them the shout out.
Yeah, go on, hype JAAQ.
You say what you saw and why you thought it was brilliant, because I know that I think it's brilliant because I'm working with them.
Firstly, the fact they're targeting like Pure Gym, right? So there's a certain type of people that are going to be going to the gym, and it was just a massive like banner, like one of those electronic ones in front of where I was doing my workout, and in between steps it was like catchy, like engaging about mental health. And I thought, you know what, I'm going to look that up, because obviously I knew I was going to talk to you on this podcast as well, and I wanted to see what else was out there. And yeah, it was really great. And so they're smashing it in terms of their educational campaigns. Seeing on the website these high achieving world leaders, professors talking about their mental health issues, because it makes you think to yourself that you can still be yourself. You can still achieve all the goals 100%. You've set out. It doesn't stop you doing anything. It's a natural part of life, and it just needs to be spoken about, and you need to manage it accordingly, and you shouldn't look at it as a hindrance. And me personally, like with my anxiety, I've changed the way I look at it, and I almost look at it like a superpower now. You know what? It's what drives me to want to carry on doing well, and the way I overthink about the future is just my drive about making sure that everything's perfect. That's what specifically I liked about JAAQ, is just the fact that they had all these stories from these high achieving individuals, and very inspirational.
I believe, JAAQ, for the listeners who don't know, just ask a question. It's a wonderful digital mental health platform all around storytelling and really learning about a condition or just a set of symptoms or something you're unsure about to do with your mental health and well-being through different people's stories. And what's so wonderful about it is culturally inclusive. It's everything. It has stories of people from all different backgrounds and different mental health conditions, and you go to their profile and they filmed that expert, whether it's a clinical expert or an expert by experience, and you ask them a question. So for instance, they've got Alistair Campbell talking about depression. They've got a really cool they've got, oh my gosh, I love him. They've got David Harewood, who's a Afro-Caribbean actor, British born, who talks about his experience of psychosis and racism, and you just ask him a question. And so it's just a wonderful platform to see. And the fact that we are moving into this health on the high street, which is something I find so exciting within the health tech and innovation space and civil science, where we're putting it into people's hands, but giving them the right tools and access. So you've seen it as someone in the gym, it piques your curiosity, and you've gone and you can see a story that maybe resonates with you and learn from them.
Amazing. And as we close up now, just give some motivational entrepreneurial advice, and then some motivational advice to anyone who, you know, is not listening to this podcast and they've come to the realization, you know what, maybe I should be seeking help, something isn't right.
Okay, so no small feat. Let's try be inspirational, Ali. So first one, from the entrepreneurship point of view, I really think if you have it in your blood, I do think entrepreneurship is something that you just have in your blood, and you just gaps. You want to. I'm a systems thinker, so I often take a bird's eye view of the situation. And I really like ideas, and I'm a bit of an ideas addict, and I have to sometimes curb my ideas. So I think my advice would be, what would my advice be? My advice would be is if you find an idea that you think will work and that you think has legs, if you find an idea that you think has legs, do your background research. It doesn't matter if there are a few competitors in the space, because at the end of the day, there always is going to be. But find a team, find someone you can go on the journey with, because it can be a very lonely existence being an entrepreneur and a founder. So co-founder and a team is always wonderful. So I definitely say keep that connection alive for the entrepreneurship. And then from a mental health point of view, I really live by the mantra of vulnerability is strength. And one of my foundational values is authenticity, another one is openness. And I truly believe that if you accept that there is something not quite right and you seek that help, you will really start to live your life more authentically and allow you to be more open with yourself and with others. And that doesn't mean that you need to be like me or other mental health advocates who publicly talk about their story. There really is no pressure to do that at all. It doesn't make me any braver, or I hate when people say that. It was just my choice. It's something I wanted to do, was share it. So I think if you just review vulnerability as strength and don't think of it as a weakness when you start to feel something psychologically.
Yeah, definitely great advice. And I love the fact that you said that your values are authentic and open, because those, having spoken to you for the past hour, those are exactly what I would describe you as. Yeah, thank you thank you so much. Yeah, thank you so much for coming on the podcast, and it's been an amazing chat. And I'll definitely be linking your socials in the bottom of the description. So if anyone wants to reach out to you, I'm sure you're more than happy to have a conversation with anyone.
And link JAAQ as well. Absolutely.
Yeah. I'll link JAAQ, and I'll of course link NutriTank as well.
Absolutely. Oh, it's been a pleasure. Thanks for having me, Ash.